Assalamualaikum and hi everyone. Here I am with my teammate are going to share our essay. The topic of this essay is the reason for the increase in COVID-19 cases. Before we start, I would like to introduce myself and my teammate. My name is Muhammad Daniel bin Abu Hassan. This is Muhammad Faizal Haikal bin Saharudin, Siti Nur Atirah binti Yusuf, and Nur Atikah Diana binti Muhammad Daud. Akira will give a brief introduction and point 1, while Atika will share point 2. I will discuss point 3 and finally, Faisal will present point 4 and the conclusion of our essays. Let us start the presentation with Akira.
Hi, I am Atira. First, I would like to start the presentation by explaining what the COVID-19. The coronavirus disease is caused by a virus, not a bacteria. Coronavirus disease 2019. A novel pneumonia disease originating in Wuhan was confirmed by the World Health Organization on 12 January 2020, before becoming an outbreak in all countries. Consequently, the coronavirus COVID-19 pandemic is the defining global health crisis of our time and the greatest challenge today. This pandemic is much more than a health crisis. It is also an unprecedented socio-economic crisis. Alternatively, border control, movement control, physical distancing, and self-protection are the efforts to raise awareness about COVID-19 have been made. There are several reasons for the increase in COVID-19, which last school opening, improper precaution, poor health detail, and improper personal hygiene. Now, we are moving to the first point of the essay. Teachers and students do not follow instruction and ignore SOP outside and inside the building. As a result, students and faculty who come to school tend to be contagious and COVID-19 can spread more easily in school. This means students and teachers must follow established procedures such as social distancing. All social gatherings, no matter how big or small, should be avoided. It is important to realize that social distance refers to the physical space used to limit the spread of aerosol or droplet, with no emotional distance. Accented that pandemic flu, which causes several emotional and psychological stress, can strike at any time and without warning. The study looked at how well early childhood education teachers are prepared to face COVID-19 in terms of planning and organization, student learning, and operation. However, this will be their first experience with being healthy prepared in all aspects such as planning, student, infection policy, and even communication to manage well in the event on another break. Following the global coronavirus pandemic, the importance of hand hygiene in preventing the transmission of microorganisms and reducing the spread of infection has been highlighted. International public health campaigns and practitioner education have focused on hand washing and hand sanitizing in the month since the initial outbreak, with little mention of hand drying. Coronavirus are a type of virus that cause mild symptoms such as a common cold, fever, cold, and runny nose. Coronavirus has had a significant impact thus far because of how widespread it is due to how easily and quickly it can spread throughout our community. That is all from me. Now we go to the next presenter.
Thank you, Atira, for the great explanation. Now I'm going to present my part. Lack of precautions is among the reasons for the increase of COVID-19 cases. It should be emphasized that following social distance, wearing a mask, maintaining hand hygiene, and avoiding large gatherings remain important in preventing the spread of infection. Hand roaming, social distancing, and quarantine are the key points in avoiding the spread in society. Detecting more COVID-19 positive patients in the population with improved testing capability would also allow for a decrease in secondary cases with tighter quarantine laws. Face mask wearers can become irritated and awkward, causing them to touch and change the mask repeatedly. Exhale air from a mask contacts with the skin, causing discomfort and a desire to finger the eyes, nose, and face, which could lead to infection. So that when you remove the mask, store it in the clean plastic bag and wash it daily if it is a cloth mask, or throw the medical mask in the trash. During MCO, people cross the border to their home without reason and proof, which can endanger other people. It is preferable if all people of this country comply with MCO due to self-internalization of the value of pursuing MCO, which is to ensure the COVID-19 chain in destroy rather than the fear of being apprehended by authorities. Mayo Clinic News Network on 9 April 2021 highlighting repeated complaints from states that people are becoming late in taking precautions against COVID-19 following public health measures like social distancing and wearing a mask remains key to slow the pandemic. That is all from me. Now I will pass the presentation to Daniel.
As you know, I am Daniel. Fallacious health details can be deadly to our community. It is known to media and all citizens that we cannot fake our health condition and need to check with doctors about our health condition to take early action, thus minimize the spread of COVID-19. Monopolizing all private healthcare and place them under the control of national healthcare system are the best things to do in this situation to counter spread of COVID-19. Person who involved in big gathering or in crowded space must be sure to wear face masks and practice social distancing at the outside. If you have symptoms such as sneezing and fever, you must go to see a doctor and get your health checked, resulting to school and workplace closed. This shown that this pandemic is quite serious. Many parents were forced to work from home with their beloved children to avoid the spread of COVID-19. Self-quarantine is the best thing to do. And do not go outside for any reason. Our sweet home has lost its primary function as daily cycle station and become sole location for self-quarantine, also workplace. New Straits Times on 9 April 2021 stated that COVID-19 cases are inflating due to newly rises of unregistered COVID-19 patients, resulting from new operations launched by the authorities. That's all from me. Here goes the last presenter of the day.
Thank you to Muhammad Daniel. Let's go to the last point of our essay. Lastly, lack of sanitation in certain places is also the reason for the increase of COVID-19 cases. Lack of sanitation can cause open defecation, increased health issue, and also high density living. According to the Mahruk 2019, sanitation importance in protecting human health is undeniable, and it has significant public health implication. Human dignity, health, and well-being have all been harmed by a lack of sanitation. 2.3 billion people lack access to better sanitation facilities. Despite 15 years of concerted effort under global action plans such as the Millennium Development Goals, communities will be affected with poor sanitation, which can cause increase in disease, decrease in schooling, and downturn in economic opportunity. Peter A. Harvey has drawn 40% of the world's population also lacks access to better sanitation. More than a century after the sanitary revolution in 19th century Europe, if the crisis is to be avoided, important lessons from the past must be implemented today. For as long as sanitation has been the weak relation to water supply, it has suffered from a lack of prioritization. 2008 was designated as an International Year of Sanitation. Everyone will be easily infected if they encounter a surface that is suspected to have been touched by a positive COVID-19 patient. COVID-19 is a modern pandemic that spread mainly through contact with an infected person who or sneeze. So let's go to the essay conclusion. To sum up everything that has been stated so far, the coronavirus disease continues to spread across the world, following a trajectory that is difficult to predict. The health, humanitarian, and socio-economic policies is adopted by countries will determine the speed and the strength of the recovery. In order to hasten the recovery, we must unite to obey the rules that have been stated by World Health Organization, such as stay at home, always wear mask at public place, use sanitizer, and much more. We must stay as we wait the scientists around the world to develop a vaccine as they did before. If we have the symptom of coronavirus, we must as soon as possible go see a doctor to avoid spreading of a virus to our beloved family and friend. That's all from me. Thank you.
That's all from us. I would like to thank you to our beloved lecturer, Madam Akmal Azlin, and the audience for your time to sit through the presentation today. Is there anyone who want to ask a question? I am looking forward to hearing from you with your questions. If you do not have any questions, we appreciate your attention and patience. Thank you.